Micropulse CPC.
Yes.
Okay.
Good morning. The topic is safety and efficacy of micropulse transcleral cyclophotocoagulation in eyes with refractory glaucoma. So, refractory glaucoma is defined as uncontrolled glaucoma despite previous filtration surgery, laser treatment, or under maximum medical therapy. Micropulse transcleral cyclophotocoagulation delivers focal delivery of energy to the non-pigmented epithelium. Delivers 810 nanometer of energy with duty cycle of 31.3%. Allows tissues to cool in between the pulses. It claims to have equal efficacy and better safety compared to diode CPC. The need for this research are there is few studies that describe the real life experience of efficacy and safety of cyclogesics in Indian population. So, to evaluate the safety and efficacy of micropulse transcleral cyclophotocoagulation in eyes with refractory glaucoma, and we are describing our real life experience. So, coming to the methodology, retrospective case series data is taken from the electronic medical record. 36 eyes of 36 patients with refractory glaucoma who underwent cyclogesis is taken. Pre-op and post-op data on biscular visual acuity, IOP, and anti-glaucoma medication were taken. Post-op follow-up of day 1, month 3, month 6, and 12 were taken. Primary outcome was defined as reduction in intraocular pressure. Secondary outcomes were reduction of anti-glaucoma medication and the number of complications. And success is taken as 20% reduction of IOP from baseline. Statistical analysis was done by SPSS version 16. The setting 2000 milliwatt, 80 seconds, 180 degrees was treated with 80 seconds. Viscoelastic is applied. Probe is kept at the limbus and moved 180 degree over 20 seconds. So this is the procedure. The viscoelastic is applied. And the probe is kept. And the probe is steadily moved. So 180 degrees treated in 20 seconds, and it is moved back and repeated once again. So 180 degrees treated in 80 seconds. So we use IDEX Cyclogesics P3 Pro. 20 seconds per hemisphere sweep and 80 degree total per hemisphere. Both hemisphere 160 seconds. Coming to the results, 36 eyes of 36 patients were taken. 66.67% were males. Mean age was 50 plus or minus 19. 66.67% were right eye. Secondary glaucoma was seen in 63.8%, and 72.22% didn't undergo any previous surgeries. Mean visual acuity changed from baseline value of 5/60 to 6/60 in 12 months. Mean IOP reduced from 37.7 plus or minus 12.9 to 21.1 plus or minus 8.2 millimeter mercury in 12 months, and it was statistically significant. Mean anti-glaucoma medication reduced from baseline of 4 to 3 over 12 months. Success was defined as 20% reduction from baseline IOP, and a total success of 66.67% was achieved, and there were no major complications. Coming to the discussion, 36 patients were enrolled in the study. Mean age was 50 plus or minus 19 years, and predominantly were males. Similar study by Kuchar et al. Included 19 patients. Mean age was 71.9 years, and the patients were predominantly females. We included a younger population in the study. There was significant reduction of IOP measurement over 12 months. Similar study by Giancarlo et al. Did a retrospective analysis of 116 eyes of 116 patients, and IOP was reduced from 22.79 millimeter of mercury to 15.3 millimeter of mercury. We had a higher baseline IOP compared to other studies. Total success of 66.67% was achieved in 12 months. Tan et al. In 2010 analyzed the efficacy and safety of Micropulse transcleral diode CPC in 40 eyes with refractory glaucoma and reported a success rate of 80% with a follow-up of 16 months. Our success was almost comparable to previous studies. It's a case example, case of uveitic glaucoma, which was refractory on 4 anti-glaucoma medication, and patient had bremonium and allergy. On top of that, she developed a reticular edema to netasodil eye drops. So cyclogesis was done, and IOP is controlled with 2 anti-glaucoma medications. So it is useful in patients with drug allergies. And this patient, 46-year-old patient, case of secondary glaucoma due to eye syndrome, patient was having refractory glaucoma, was on 4 anti-glaucoma medication. Cyclogesis was done, and IOP is under control on 3 anti-glaucoma medication, and the patient underwent NPDS. So it was useful in patients who needs short-term reduction of IOP and to plan a definitive procedure. And it is a one-eyed patient, 12 years old, case of aphakic glaucoma, both eyes, which was refractory. And patient was on 3 anti-glaucoma medication in right eye, and IOP was high. Cyclogesis was done, and IOP is now under control on 2 anti-glaucoma medication. It's useful in one-eyed patient and especially children due to its good safety profile. 15-year-old patient with secondary glaucoma post PKP, left eye is refractory, and patient was on 4 anti-glaucoma medication. And the best corrected visual acuity of the patient was 6/60. Cyclogesis was done, and IOP is under control on 3 anti-glaucoma medication. BCVA is 6/60. So visual acuity is maintained and is better for patients with good visual acuity. And it's also a 10-year-old boy, a case of traumatic glaucoma, right eye refractory on 5 anti-glaucoma medication. Cyclogesis is done, and now IOP is controlled on 2 anti-glaucoma medication. And this is the point where the cyclogesis was done, and there is a steep reduction in IOP. So to conclude, Micropulse transcleral cyclophotocoagulation is a safe and effective method of lowering IOP in cases of refractory glaucoma. Thank you.
So it's helpful for short-term control, no? So what's the duration of efficacy?
That control mainly 3 years maximum.
Maximum 3.
And we can repeat it. That's one.
Topical or block?
The block only, sir. We usually do under. Mainly, actually, one thing is that some of the cases were children, and then also we block and. Like if there is any pain and no, we do.